So one of the sessions, which is the one I'm involved in, is called "Why Am I Still Having Seizures?" Management of the patient with continuing seizures. And it's like many other topics, it's a very practical topic, something we face day to day, questions that we get asked by our patients in every clinic that I attend, and I'm sure pretty much in yours as well. And even though they are not asking, this is something that very much in the back of their mind. And the reality is, despite we've spent tens of billions of dollars, literally, in the past 20 to 30 years developing new drugs, of which we now have many patients still have seizures, despite taking the drugs, these medications. It's not to say that they haven't, these new drugs haven't brought any benefit to patients. You know, some are clearly more better tolerated, or have a better or less likely to cause drug interactions, I should say, so maybe safer. But in terms of stopping seizures, they haven't really made any significant difference. My talk is looking at treatment choices and AED selection and options in patients in this scenario. And so what I will be talking about will be looking at not just so much about drilling down to each individual drugs, because it wouldn't be possible within the limited time, but rather to discuss what are the latest thinking in how we can select drugs that we currently have, and asking the question specifically on, can we select drugs better? Is there a better way to find drugs? Because the way we select medications these days are very much trial and error. We have some idea, a list of drugs in our head that might suit patients with certain types of seizures, but beyond that, we really don't have a lot of pointers in how to select medications. So I'll be presenting some new thinking, some new research we've been doing, including using medical artificial intelligence to help us predict outcomes in patients, and whether that can become a decision support tools for neurologists, not to replace neurologists' clinical decision altogether, but as a support tool for them.